Hi guys, so today we are going to talk about pathology and pharmacology. So in yesterday's video, we talked about the pharmacology introduction. So today we are going to talk about the pathology. So let's start. Okay. Actually, I also haven't talked about. I also haven't learned about this topic. So we will discuss it together. Okay. Let's begin. I'll just quickly download it. And E E. I can't find it. Okay, so pathology introduction. So pathology is a study of disease. The word pathology is derived from two Greek words, pathos meaning the suffering and logos meaning study. Pathology is the study of structural, biochemical, and function changes in cells, tissues, organs, and that underlie the disease. Knowledge and understanding of pathology is essential for all would be doctors, general medical practitioners, and specialists, since unless they know the causes, mechanisms, nature, and types of diseases, and understand the language spoken by the pathologists in the form of laboratory reports, they would not be able to apply appropriate treatment or suggest preventive measures to the patient. So, for the student of any system of medicine, the discipline of pathology forms a vital bridge between initial learning phase of pre-clinical sciences and final phase of clinical subjects. Uh, remember the prophetic words of one of the eminent founders of modern medicine in late 19th and early 20th century, William Osler. Your practice of medicine will be as good as your understanding of pathology. Okay. So this fucker William Osler said that your practice of medicine will be as good as your understanding of pathology. Okay. So what will you study when taking a pathology course? A course of pathology will teach students how they can identify the abnormal function that are caused by tissues by disease. Sorry, pathology is a study about principles of the study, how to use critical thinking skills to apply these principles, how to explain the effects of disease, risks in the environment that lead to disease, and different factors that can affect healing. It is also common to perform diagnostic testing as a simulation so that the student will be able to um, the relationship between symptoms and abnormalities. What is health and what is disease? Health, definition of WHO, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Disease. Disease is defined as a deviation from normal physical, mental, and social well-being that causes a disruption or loss of homeostasis. Homeostasis is a self-regulating process by which an by which an organism tends to maintain stability while adjusting to conditions that are best for its survival. If homeostasis is successful, life continues. If it's unsuccessful, then it results in a disaster or death of the organism. Disease effects. The disease effects depend on which organs or tissues are affected. Diseases may be classified as a congenital, hereditary, degenerative, inflammatory, metabolic, neoplastic. Okay, so there are six types of diseases: congenital, hereditary, degenerative, inflammatory, metabolic, and neoplastic. Okay, so hereditary, neoplastic, inflammatory, degenerative, and metabolic. Okay, so congenital, hereditary, then we have the neoplastic, then the inflammatory, then the metabolic, and then the degenerative. Okay. Minor changes are usually corrected by the body, which eventually returns to its normal state. Age, gender, family history, environment, and levels of activity all influence and all influence and individual's normal state. Okay. So the structure of pathology, general pathology, special pathology, or organs or systems. General pathology deals with the common basic reaction of cells and tissues to injury stimuli. Examples of general pathological processes: inflammation, fever, hypothermia, shock, stress, edemas, disturbances of control mechanisms, hyperreactivity, hyporeactivity, damage of genetic information. Then, spatial pathology describes the specific responses of specialized cells from and tissues to injury stimuli. Is devoted to the analysis and explanation of pathomechanisms involved in the functional disturbances of the organ and system in organism. Disorders of cardiovascular system, genetic disorders, gastrointestinal diseases, nervous system diseases, and the renal diseases. Now, the special pathology disorders of endocrine system, pulmonary disease, disorders of immune system, blood disorders, metabolic disorders, and reproductive tract disorders. Okay, so terminology in pathology. It is important for a beginner in pathology to be familiar with the language used in pathology. A patient. Who is the patient? So, patient is the person who is affected by a disease. Lesions are the characteristic changes in tissues and cells produced by disease or in an individual or experimental animal. Pathology changes or morphology consist of a examination of a diseased tissue. Deceased. Okay. Causal factors responsible for the lesions are included in etiology of disease, that is why of the disease. Mechanism by which lesions are produced is termed pathogenesis or disease or how of disease. Okay, why is this disease caused? So that is a why. This is the etiology or cause of the disease. Okay, and mechanism is how does this disease cause? So that is called the pathogenesis. Okay. Functional implications of the lesion felt by a patient are symptoms and those discovered by the clinicians are physical signs. Okay. So signs are basically the things that we can measure. Signs, we cannot measure the symptoms. Symptoms are subject to data. So subject to data means the data which is given by the patient. Okay, patient tells us that he has headache. We can't be sure that he has he has what he has, what he is saying, but we have to trust him. Okay, and objective data is basically the data which we can measure, like the BP of the patient, like the heart rate, the heartbeat. Okay, so the uh, stethoscope, right? So these are signs. Signs can be measured, symptoms can't be measured. Okay. Clinical significance of the morphology and functional changes together with the results of other investigation helps to arrive at an answer to what is wrong diagnosis, what is going to happen prognosis, what can be done about it, treatment, and finally what should be done to avoid complications and spread prevention. So etiology of disease. Etiology is the causative factors of a particular disease. Etiology, eti- etiologic agents include congenital defects, genetic or inherited disorders, viruses, bacteria, immune dysfunction, metabolic conditions, degenerative changes, malignancy, burns, etc. The cause of a disease may be intrinsic or extrinsic in nature. Okay. Examples of intrinsic causes of a disease include age, inheritance, or genetic abnormalities. Examples of extrinsic causes include infectious agents or behaviors such as inactivity, illegal drug abuse, or smoking. In certain cases, a disease may have no known cause and is referred to as idiopathic. No known cause. A disease with no known cause is called the idiopathic disease. Okay. Fine. So pathogen and agent which causes disease. Multifactorial, referring to influence of multiple factors in the etiology of a particular disease. Example: diabetes, hypertension, attributable to genetic and environmental components. Idiopathic, in certain cases, a disease may have no known cause. Example: pulmonary fibrosis, segmental glomerulosclerosis. Localized disease, a disease which affects only one part of the body. A disseminated disease has has aspir- has spread to other parts. A systemic disease is a disease that affects the entire body. Okay. So local it is like only this part. Okay. Only this part of the body. Disseminate means like it can spread to other body, other organs of our body. Okay. And systemic means it can affect the entire body. Okay. So an acute disease lasts for a short time but develops quickly with marked signs such as fever and pain. Chronic, long term, developing gradually with lesser symptoms, usually causing more permanent damage. Often a chronic disease involves intermittent acute episodes. Example: rheumatoid arthritis. Latent, an initial silent disease stage in which no clinical signs are evident, may be referred to as an incubation period lasting between 1 day and several weeks. Asymptomatic, no no, no noticeable symptoms. Semiology. Semiology deals with the symptoms and signs of disease. Symptoms: subjective feeling of disease, pain, nausea. Signs: objective. See, I told you. Symptoms mean subjective feeling, and signs mean objective parameter of change, function, and structure of body systems. Measurable fever. Okay. Signs refer to objective evidence of a disease, while symptoms are more subjective in nature. Blood in stool is a sign of a serious problem, while the stomach is better defined as a symptom. Both signs and symptoms, however, warrant further examination to determine a cause. Okay. Syndrome, the association of several medical signs, symptoms, and or other characteristics that often occur together. Disorder, a functional abnormality or disturbance, mental, physical, genetic disorders. Onset, the speed of development of a disease, which may be sudden and obvious, acute or insidious, with gradual progression and vague or mild signs, remissions, subsiding disease symptoms, symptom-free period, along with exacerbations. Remissions mark the progress of a disease. Exacerbations increase signs of disease. Along with remissions, they mark progression of a disease. Manifestations, clinical evidence or effects, signs and symptoms of a disease. Example: redness, swelling, fever. Okay. Complications, new additional secondary problems arising after an original disease begins. Example: a heart attack patient develops congestive heart failure as a complication. Diagnosis: identification of a specific disease via evaluation of signs and symptoms, level of disease. Laboratory tests or other tools are often used to verify several factors to confirm a diagnosis. For example, pain, swelling, and position may indicate a broken leg bone, but confirmation is via X-rays. Sorry. So, predisposing factors, those that indicate a high risk for a disease but not certain development. Example: exposure to asbestosis is a predisposing factor for cancer. Precipitating factors which trigger acute episodes. Prodromal period, the time in early disease development when a patient is aware of a non-specific change in the body. Example: fatigue, headache, loss of appetite. Prognosis, the probability or likelihood of a recovery or other outcomes. Recovery period of a re, recu- of a recuperation or convalescence and return to normal health. It may last for about several days or months. Epidemiology, the science of tracking the occurrence or pattern of disease, includes data on transmission and distribution of disease, which is used to detect patterns yearly by major data collections centers such as CDC and WHO. Endemic, a disease that exists permanently in a permanently, okay, in a particular region or population. Malaria is a constant worry in parts of Africa. Okay. Epidemic, an outbreak of disease that attacks fuck, people's wow, water. uh, Epidemic, an outbreak of disease that attacks many people at about the same time and may spread through one or several communities. Pandemic, when an epidemic when an epidemic spreads throughout the world. Morbidity, the disease rates within a group. Mortality indicates the the number of deaths from a particular disease. Example, the mortality rates of heart disease and cancer are higher than other diseases. Okay. Communicable infection that can be spread from one person to another. So certain communicable diseases must be reported to health authorities. An example of a communicable disease is measles. Comorbidities. Okay, two or more coexisting but unrelated medical conditions. Example: post traumatic stress disorder with borderline personality disorder. Okay. So, diseases are generally classified into broad categories. Those in each category may not be closely related, and many diseases from different categories have similar morphology or pathogenicity. These categories are as follows: congenital and hereditary diseases caused by developmental disturbances such as chromosome and genetic abnormalities, intrauterine injury, or combination of environmental and genetic factors. Examples include hemophilia and congenital heart disease. Chronic or steadily worsening disease causes degeneration of various body parts, often as a result of aging. Degeneration often occurs sooner in the life of the patient and is not linked to aging. Examples of degenerative diseases include certain types of arthritis and arteriosclerosis, hardening of the arteries. Okay. Metabolic diseases cause disturbances in normal metabolic processes. Examples of metabolic disease include diabetes, thyroid conditions, endocrine gland disturbances, and fluid and electrolyte imbalances. Neoplastic disease characterized by abnormal cell growth. These diseases lead to various benign and malignant tumors. Inflammatory diseases. Those in which the body react to injury or harmful agents with inflammation. Causes include various microorganisms, allergic reactions. 1 second, guys. My heater is not working. Not able to- So we will read again the inflammatory diseases. So those in which the body reacts to injury or harmful agent with inflammation. Causes include various microorganisms, allergic reactions, hypersensitivity states, and autoimmunity states. Some inflammatory diseases may be of a unknown origin. Examples of inflammatory disease include the pneumonia, sore throat, and hay fever. Why pathophysiology is important for physicians? It helps them to find answers to important questions, which are influence in okay. So, what is the cause of disease, and why the disease and why the disease is developing? What are the mechanisms responsible for disease onset, progression, and recovery? If doctors are able to understand the causes and mechanisms of the disease, then they are able to find the way how to influence them rationally. Epidemiological triangle: agent, host, environment, disease. Determinants of disease: agent, infectivity, pathogenicity, virulence, immunogenicity, antigen stability, survival. Okay. So host is species, age, gender, genotype, formation, nutritional status, health status, and physiological status. Environment, climate, housing, geography, noise, habitat, diet, equality. What are the agents of disease? So, microorganisms and parasites, toxins, deficiencies, genetic disease, metabolic disorders. Pathogenesis means pain, suffering, distress. Genesis means onset or deals with the mechanisms involved in disease onset and diseases development mechanisms. Progression of disease, example, atherosclerosis, changes in wall of the vessel. Genetic or exposure, preclinical phase, not clinically evident, but morphological changes occur. Third is a clinical phase and fourth is the outcomes. Investigation and diagnosis. When a patient presents with signs and symptoms, healthcare professionals should investigate the causes to determine a diagnosis. Investigation can include everything from blood tests and X-rays to more invasive measures such as endoscopies. In most cases, investigation will reveal the root cause of signs and symptoms, and the disease can be officially diagnosed. Many methods of diagnosing disease available today are classified as either invasive or non-invasive procedures. The invasive procedures require the patient's body to be invaded and include the use of needles, catheters, and other instruments. With the non-invasive procedures, there is either no risk or only minimal risk to patient. Non-invasive procedures include the radiographic procedures and urine testing. In general, invasive procedures have higher risk for potential damage than non-invasive procedures. Okay. The healthcare professional must weigh the potential benefits versus the potential risk for any procedure before proceeding. Patients must be fully informed about these benefits and risks. Invasive and non-invasive diagnostics procedures may be classified in a variety of ways. Okay. Um, Clinical laboratory tests, blood and urine testing to check for variation in components such as urea, hemoglobin, cell counts, enzymes, or organ function, clearance rates, clearance rate, uptake, and excision rates, amounts of microorganisms, organisms, and antibodies. Organisms 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 and antibodies Diagnosis of disease. Cytological or histology. Examination of cells and tissues. These tests may reveal the causes of a disease based on small samples of tissues removed from affected tissues or organs. The procedure used in this test is called a biopsy. Electrical activity tests include the electrocardiogram, electroencephalogram. Many heart conditions are determined and assessed with these tests. Brain tumors, strokes, and other alterations to cerebral function are also able to be assessed. Endoscopy. The use of a flexible or rigid tubular instrument to examine various areas of the body. Each instrument is named according to the type of internal examination for which it is used. And endoscopy is an examination of a interior of the body, including the esophagus, stomach, trachea, major bronchi, bladder, colon, and rectum. Endoscopes are and related instruments use a light source along with a system of lenses. Examples of instruments include esophagoscope to examine the interior of esophagus and gastroscope to examine the stomach, bronchoscope to examine the trachea and major bronchi, cystoscope to examine the interior of bladder, colonoscope to examine the entry length of the colon. So as you can guess, the initials of the scope like gastro is for the stomach, okay. Bronchi is for the bronchi and the trachea, because cysto is for the bladder and colon is for the colon. So yeah. Laparoscope. Similar to endoscope, this procedure uses laparoscope to look inside the abdominal and pelvic organs, as well as to remove the gallbladder, appendix, ovary, and for other smaller surgical procedures. X-ray examination uses the passage of X-rays through various areas of a body to be examined, with the resulting image exposed on an X-ray film. Computed tomography is used to produce cross-sectional images of the body from various angles. Prognosis. Finally, after diagnosis is made and the patient disease has been or continues to be treated, healthcare professionals can issue a prognosis. Prognosis are educated are educated predictions of a patient's chance of recovery or survival. Some patients can expect a full recovery, or other diseases may eventually be fatal. Treatment. Once a disease has been diagnosed, doctors can begin treatment. Some disease can be cured outright with simple measures, such as antibiotic regimens. In other cases, doctors and nurses may only be able to treat the uncomfortable symptoms of a disease for which no known cure exists. Thanks, ना बड़ा और last slide. Okay. So prevention. Prevention. Healthcare is focused on prevention of disease. The knowledge of our previous cases and the outcomes is used to develop treatment new treatment strategies. For example, before 1918, there were no available treatment for what we know now as AIDS, because the condition was yet to be diagnosed. Since then, knowledge of disease and its transmission has helped in the development of many drugs that have successfully slowed the activity of the virus. More significant prevention is attained by the use of routine vaccinations. genetic screening, blood pressure testing, and other programs. Preventive measures include dietary changes, lifestyle changes, vaccinations, environmental changes, and quitting smoking or drinking alcohol. Levels of prevention. So primary altering the susceptibility, reducing exposure for susceptible persons. Secondary early detection, screen of diseases, tertiary rehabilitation, supportive care, and reducing disability. Okay, guys. So that's it. Hi. Guys, what I was saying is that I will start the lecture of microbiology again. I guess I will start it from tomorrow onward because we haven't completed all the gram positive bacteria, and also the gram negative bacteria are also there. They're also remaining, right? So we will discuss it, and yeah. Okay. Bye, guys. Love you.